Hello there, Luke Love here, creator of My Health Movement and co-founder of UniteDoc. For years, my family, like so many others out there, had struggled with medical debt. And today, I've got an amazing training video for you on how you can reduce your overall healthcare expenses. So here's the deal. My Health Movement and UniteDoc are completely changing the way folks approach and feel about healthcare. And it's no wonder. With the increased costs of healthcare coverage, increased monthly premiums, higher co-pays, skyrocketing deductibles, and even more frequent claim denials from our insurance, it's becoming more and more difficult for folks to receive quality care without fear of a significant financial setback. Just last year, I spent almost $9,000 on medical expenses, and I didn't even have any significant procedures done. I mean, that's a small number for a lot of people. But because I've got a $6,000 deductible that I have to pay, I've got co-pays, I've got procedures that the insurance didn't cover. All these things together, I've spent almost $9,000. What'd that cost the insurance company? Nothing. Well, actually nothing at all. The hospitals overcharged me the whole way, the insurance companies allowed it, and they didn't even have to pay for any of it out of their own pocket. So that's the problem that we're facing today. Now, these strategies don't only work for the insured. If you're uninsured or underinsured, you absolutely need to check out the video. Download that PDF down below, grab a pen, take some notes. I'm going to be moving fairly quickly here. So here's what we're going to cover. Number one, we're going to talk about the health advocacy phenomenon. Okay, how did we get here and what do we do about it? Next, we're going to talk about some of the non-starters. There's a lot of folks out there like, Luke, I don't completely understand, I've already got insurance. What is it that this new way of doing healthcare is all about? Number three, we're going to talk about some of the freedoms, some of the benefits you're going to experience in your own life when you implement these strategies. And lastly, I'm going to talk about the 6 core strategies that I leverage with my family to reduce overall healthcare expenses pre-doctor visit, because that's really where you need to start. We're also going to give you a quick behind-the-scenes sneak peek, if you will, of how folks are leveraging UniteDoc and My Health Movement to make significant financial strides in their own lives.
Whether you're on the beaches of Kauai, I've used UniteDoc in Arkansas, in Missouri. I travel for a living, and I know that if I ever get sick or even just feel some kind of a pain or something, 24/7 I can call a doctor. I've saved lots and lots of money.
And my hospital bill was $3,500. I submitted the bill to UniteDoc, and they found out that I was misbilled, and so it came in at $2,650. That has already saved me over $900.
Logged into the member portal and looked up the medical bill saver, and it was so easy.
I really, really love this service.
So what do I mean by the health advocacy phenomenon? What I mean is, today, more than ever, folks need a little bit of extra help making sure they're not being taken advantage of by our healthcare system. Research shows that almost 80% of every doctor bill has errors. Those errors can come in the form of overcharging, duplicative charging, price gouging, etc. Now, insurance companies don't have the time or the resources to look through every single claim that comes through. So more than ever, like I say, today folks need a little extra help making sure they're not being overcharged and taken advantage of. So the first major objection that I receive when introducing people to this new way of doing healthcare is, I already have insurance. Now, a lot of people already have insurance. I already have insurance. But if you've got a high deductible plan, or if you're spending money on co-pays, whatever the case, you absolutely need to leverage these strategies and these services. Hospitals are overcharging people at an alarming rate. I mean, 8 out of 10 bills that come from providers have some sort of error. There's federal lawsuits in place right now where Medicare is suing almost 90% of the hospitals across the United States for overcharging. If the federal government's getting overcharged, I guarantee you are as well. The second main objection that I receive is, I'm a healthy individual, I just don't really need a lot of health care. you never know what's going to happen. I mean, when I was 19 years old, I was at a family reunion. I was getting ready to ship off to the military. I didn't even have insurance at the time. My brother and I, we were wrestling around. I slipped and fell, hit my finger, and dislocated it. All right, my finger looked pretty mangled at the time. It was just a simple dislocation. You know, of course, my dad, old school guy, he wanted to, you know, wrap the belt around it and just pull it back into place. But I, seeming foolishly now, opted to go to the hospital. So I go to the emergency room to get my finger put back in place. I sat in the emergency room waiting for about 4 hours. So 4 hours I sat there. I finally get back. He sends me in to get an x-ray. The doctor does. You know, I get an x-ray. I come back in. You know, oh, yep, it's dislocated. Pops it back into place. Sends me to get another x-ray. Right? Verify that the thing, you know, my finger is in place where it needs to be. Send me on my way. So 6 hours of my life, you know, gone. And about a few months later, I get a bill for $1,800. So that's where our services come in. And anything that happens, you know, if you're a healthy individual and you just don't think that anything's ever going to happen, I mean, it doesn't take much for you to really be in need of some sort of financial assistance. Now, the third main objection, the one that I hear fairly often, is it's just too good to be true. For this kind of price tag, for all of $257 a year, how in the world can you provide all these services? I mean, dental, vision, LASIK, we're talking telehealth, we're talking bill negotiators. The entire package for $257 a year, how is it possible? Now, guys, when our founder and CEO, Michael Scavuzzo, first introduced me to the idea of starting this company, we both had to validate that all these services work perfectly. So we signed up, we started using these services, and I called every single one of them. When you sign up, you get a nice little card in the mail. It's got a list of phone numbers for every different service that you can use. Right? I called every single one of them. I inquired about all the services that they offer, and the only thing that I came away from was that the customer support was fantastic. All of these services are completely legitimate. I've used a lot of them. I've used all of them. I haven't gotten LASIK yet. You know, I haven't used some of the diabetic supplies, some of those sorts of things. But I've leveraged the telemedicine over and over and over again with my children, with myself. I've leveraged the bill negotiators. I've inquired about the dental discounts, the LASIK discounts, the eyeglass discounts. There's all kinds of services that you can really save a lot of money with. And like I say, it's only $18.95 a month. All right, so let's talk about the 6 core strategies to save money. Now, the first one is, well, you might imagine, limit the amount of exposure to extremely expensive healthcare providers. Stay out of the emergency room when you can. Stay out of urgent clinics when you can. And one of the great ways to do that is through telemedicine. So stay tuned here. I've got a quick video about our telemedicine offering.
Did you know that in the course of a year, you'll see your doctor close to 3 times for one of these typical conditions? And for your kids, almost 4 times. So what do you do about it? You normally have 3 options. The first thing you should do is call your primary care physician. But what if getting an appointment takes too long? Or even worse, what if traveling makes it impossible? You could head to an urgent care clinic. But do you want to spend $150 to wait in a room that might be full of sick people? And then there's the emergency room, but that would cost $750. And the waiting room might be full of really sick people. Wouldn't it be great if treatment could be simple? That's what Teladoc is for. This is how easy it is to use. First, sign up and fill out some health info. When one of these strikes, and your doctor is unavailable, go online or call Teladoc to request a consultation with a U.S. board-certified doctor. Get on a call or video chat with your doctor who is licensed in your state. Explain every detail of your issue. There's no rush. Take as long as you need. The doctor will listen carefully. And when enough details are given, we'll diagnose what you have. A prescription is sent to your local pharmacy if necessary. All of this was done in less than an hour. Average amount of practice experience of teledoc doctors, 15 years. Average time it takes to get a call back from a teledoc doctor for the quality care you need, 22 minutes. 91% of all medical issues resolved. 97% of customers satisfied. Who said getting quality care has to be complicated? Try it once. You'll love it.
So, beyond telemedicine, I highly encourage people to leverage local community clinics. They're tremendously less expensive, and also just stay in shape. Go for a walk, do what you got to do. So the second thing, the second strategy here, the second step really, is to contact your provider. Who's the person doing the procedure? Contact them, ask them how much the procedure is going to cost. Ask them what the procedure even is. All right, if you can get some of this information up front, it's going to save you a whole lot of money later on. Okay, now, if you can get the billing codes, the actual billing codes of the procedure, it's going to be a big help for you. So number three, once you've found out what the procedure is and how much it costs, you need to reach out to your insurance company. First of all, is the provider in network? Okay, so you need to contact the insurance, find out if the provider is in your network. That's going to save you a lot of money. Next, is the procedure that they're going to perform covered? Sometimes it won't be. If you get a procedure that's out of network, you're going to have some financial woes. So find out what the procedures are, make sure the provider's covered. Number 4, you know what the procedures are, you know that everything that you're doing is in network. Now it's time to look up how much these procedures actually cost. Okay, now there's a few things you can do. One thing that I like to do, I like to run out to myhealthcarebluebook.com. If you know exactly what procedures you're going to have done, you can reach out to myhealthcarebluebook.com, find out what some of these are going to cost. I also like to use Medicare prices. Medicare receives 73% discounts typically on procedures. Insurance companies get 20 to 50%. If you can try to get those kind of numbers yourself, you're going to be in a lot better shape. So the fifth thing that we can take a look at once we've got our costs is really just to start shopping around. All right, you need to shop around, call different providers, make sure they're in network, and just go for the lowest bidder, giving you the highest quality care, of course. And number 6, once you've done all this, if you're still not happy, reach out to our bill negotiators. Our bill negotiators aren't just post-bill. This is pre-bill. Our negotiators, our team, can look up specialists for your procedure. We can pre-negotiate a fair price before you've ever even gone to the hospital. So a lot of times, there's a lot of things you can do yourself, but leave it up to the pros when you need a little extra help. We're about 15 minutes in. I'm on my 3rd shirt, and it's about time to wrap things up here. So if you're ready to start your 30-day money-back guarantee trial, please click the link below, get yourself and your family enrolled, and start saving a lot of money. Now stay tuned. I've got another video coming, the core strategies on ways that you can save money post-visit. So this was pre-visit. My next one's going to be post-visit. And also, I'd love it if you'd leave me a comment. Leave me a comment below. Let me know what you thought, and I can't wait to see you in the next video.